Hello, and welcome to the St. Luke's and Roosevelt Hospital's Center for Advanced Medical Simulation, CAMS. I am Dr. Hassan Kouli, the Medical Director. I would like to introduce you to our simulation-based training program here at CAMS. Medical simulation is defined as a situation or environment created to allow persons to experience a representation of real event for the purpose of practice, learning, evaluation, testing, or to gain understanding of systems or human actions. The goals of simulation-based training are to develop and refine numerous skills. These may include cognitive, procedural, and teamwork-based training skills in a safe learning environment. Your educators will attempt to recreate realistic patient care situations. This will maximize your learning experience if you treat the simulated patients and environment within the same care and professionalism that you would for an actual patient. The CAMS environment and patient simulators may have certain limitations in their ability to exactly mirror real-life situations. When this happens, we ask that you suspend your disbelief in order to facilitate the learning process. During the time you spend here, you may meet several faculty and staff members who are here to facilitate your training and maximize your learning experience. Now, as we begin the tour of our facilities, I will be joined by Dr. Keith Rose, the Assistant Director of the Simulation Center, and Stephen Simon, our Simulation Specialist.
I'm Stephen Simon, Simulation Specialist here at CAMS. When you arrive for your session, you should report to the conference room. It's located at the end of the hallway, next to SimLab 1. Let's go have a look. The conference room is a safe place for you to leave your personal belongings, as well as any food or drink you might have brought with you. As a reminder, food and beverages are not permitted in any of the sim labs. If you have valuables, please keep them on your person at all times. CAMS is not responsible for any lost or stolen property. When you arrive in the conference room, remember to fill out the attendance form with your name, email address, and department. Before each session, your instructor will provide you with a brief introduction to the course and the simulation environment, including your role and that of the facilitator. The educator will also review expectations of you, as well as any evaluation that may take place. Your session will begin as soon as you enter the lab room. There may be a faculty or staff member in the room with you. They will help facilitate the case by playing the role of physicians, nursing staff, or as family members. You're expected to interact with them as you would if the scenario was taking place in a real clinical setting, and they will assist you accordingly. Now let's go and see the sim labs.
Hi, I'm Dr. Keith Rose. I'm the Assistant Medical Director here at CAMS. Welcome to Simulation Lab number 1. You'll find that each of the labs here and the Simulation Center are all essentially identical in their setup. Each lab contains a high-fidelity patient simulator or mannequin. There may be small differences between each mannequin. However, if they're important in the case, your instructor will let you know. Each lab also contains a code card. This code card is identical to each of the code cards found on the floor throughout the hospital. Please access and use the code card exactly as you would in a real medical code. Additionally, each room contains 2 other cards. There is your standard procedure card here, and there's also a supply card. The supply card contains equipment pertinent to your simulation session, such as airway supplies, labeled medications, IV fluids, suction and oxygenation equipment. You should note that all medications used in the sim labs have been replaced with distilled water. Under no circumstances should medications found in the sim lab be taken onto the floors or vice versa. Each room is equipped with a full medical gas setup, including compressed air, oxygen, and suction. When needed, you should use the appropriate gas settings. In this case, I will be placing the patient on 100% non-rebreather oxygen. If vitals are needed, or an EKG is needed, these will appear up on your monitor. It's important to note that the blood pressure on the bottom left-hand corner of the screen will not continue to recycle on its own. If you would like to repeat blood pressure, you must push the start-stop button to get your blood pressure reading. If you request labs or imaging, they will be provided to you on the television located within the simulation lab. Requesting consult services may be a part of your session, and they may respond in person or as telephone consults.
Over the next few minutes, I'd like to discuss with you some of the features of our most commonly used mannequin, the SimMan 3G. SimMan is controlled by a computer that relies on a simulation specialist to drive the underlying physiologic changes that you will see inside the lab. The SimMan 3G is a full-body simulator with realistic anatomical landmarks that can simulate a wide variety of lifelike physical findings. SimMan exhibits spontaneous breathing with chest rise and fall, measurable cardiac rhythms, and many other clinical signs. Embedded within the skin are a series of small speakers that produce normal and abnormal heart sounds, lung sounds in all fields, including posteriorly, and bowel sounds. Please remember to bring a stethoscope with you to your sim sessions. Interacting with the simulator is easy, as the operator can speak through the simulator via microphone or through a set of pre-recorded vocal sounds.
No, I've never had pain like this before.
Please speak with the simulators as though they were real patients. Your interaction with the simulator will help your educator evaluate you both clinically and professionally. Because SimMan 3G has an anatomically correct airway down to the level of the bronchi, several airway management procedures are possible. In many cases, a head tilt, chin lift, or jaw thrust will be necessary for bag valve mask ventilation. Several airway adjuncts may also be inserted, including an oral airway, a nasal trumpet, and a laryngeal mask airway. SimMan may be intubated either orally or nasally, and if needed, you can perform a surgical cricothyrotomy. When intubating the SimMan 3G, please use a size 6 ET tube, as this is less damaging to the internal structures of the mannequin. SimMan 3G is also able to recreate several airway complications, including mild or severe tongue edema, pharyngeal swelling, laryngospasm, decreased cervical range of motion, or trismus. If you feel resistance in the neck or find it difficult to pass an endotracheal tube, please do not force it. These are intentional clinical findings, and excessive pressure can damage the simulators. Airway lubricant will be available and must be sprayed on all tubes prior to insertion. Depending on the clinical setting, you may experience variable lung resistance and compliance when ventilating. If needed, SimMan 3G can be connected to the ventilator. The ventilators are preset to a tidal volume of 300 cc's and a PEEP of 0. Please do not change these settings, as they are in place to prevent damage to the lungs and extend the life of our simulators. Please verbalize to your instructors the settings that you would actually desire. A tension pneumothorax may be relieved by performing a needle decompression at the appropriate anatomical site using a 22-gauge needle to minimize simulator damage. A complete chest tube insertion may also be performed at the appropriate clinical site on the simulator's left or right side. Pulses can be palpated on the simulator at the carotid, brachial, radial, femoral, posterior tibialis, and dorsalis pedis. These pulses will activate only when palpated, and pressure must be applied before a pulse can be felt. However, applying too much pressure can eliminate the pulse. The simulator is supplied with a pulse oximeter, which can be attached in the usual manner. Remember that the monitor will not display an O2 sat if the sensor is not connected to the patient.
In the event of a cardiac arrest, full CPR can be done on the mannequin. The mannequin can also be defibrillated in a standard fashion. Using defibrillator pads, you place them on the metal contact points on the simulator. The blue pad normally placed in the center of the chest. We generally place upside down to allow the puck to be in the center of compression. And the posterior pad will be placed on the metal contact point here, as such. Alternatively, the paddles may also be used for defibrillation. You will notice that on the defibrillator, it is set at 30 joules. This is done for safety. However, while doing a simulated code, you must state what actual amount of joules you would like to use during that CPR. You will also note that during the CPR, the chest compressions may give you artifact on the monitor here, which may also be noted on the patient's monitor at the bedside. If you need to log roll the patient, just be careful and take note of the Ethernet and power cables here located at the patient's right hip. These can be damaged easily. Vascular access is possible through a pre-placed IV in the right antecubital vein. Additional IV access will either be placed by a nurse facilitator or confirmed verbally. The simulator is capable of producing a number of other clinical signs, including seizures, diaphoresis, and urine. Cyanosis is indicated by a blue light in the oral airway. Full pupil reactivity can be emulated with bilateral or unilateral constriction and dilation. The pupils will respond to light.
Following your session, you'll be debriefed by your educator and CAMS staff. Debriefing is defined as a conversation between two or more people to review a real or simulated event in which the participants analyze their actions and reflect on the role of thought processes, psychomotor skills, and emotional states to improve or sustain performance in similar situations. Our debriefings are conducted in a non-judgmental and safe manner. You're encouraged to share your genuine thoughts and emotions to the case without the fear of being shamed or humiliated. We want to emphasize that the focus of the debriefing is on learning and not on making people feel bad about making mistakes. Remember, we expect mistakes and ask only that you learn from them. Educators will help you analyze your actions and thought processes at key moments as you review the case, and they will give you concrete feedback on your performance or that of your team. The educators may use video or recorded data to support analysis and learning.
Before we conclude this video orientation, I would like to go over a few points related to evaluations and video taping. Simulation is like any other type of educational activities. There are some evaluations involved that provide you feedback and provide the educators feedback too. This feedback that we get will be using to identify your strengths and area that you need to work on and incorporate into further educational activities. Simulation may be used for formal performance evaluation and assessment. You will be informed if your training session will be used to grade you. Simulation sessions conducted at CAMS may be video recorded and used for evaluations and assessment that can be done by the sim staff as well as by the educators. All video recording tapes will be used only by you or by the educator responsible for the courses. This concludes our orientation video. We hope you find your experience at CAMS enjoyable and educational. In the future, if you have any questions related to your training session or to simulation in general, please contact our Simulation Center staff. We hope you enjoyed your simulation session today.